Hi everybody, it's Mary Agnew, Vice President and Chief Nursing Officer, and I'm very pleased that I was asked to be able to preface your town hall meeting in the medical division. Thank you very much for that invitation. Thanks to Tim and thanks to the team of managers. And first off, I want to give my sincere thanks and congratulations for our magnet designation. This happened because of all of you. The four appraisers that came for our site visit spent their time with the staff. They spent very little time with me or with other members of the senior team or even our director group. They spent more time with you, with some of your managers, and so the credit really goes to all of you for our magnet designation. And I hope you love as much as I do the two big, huge banners hanging out front of the 6th Avenue entrance. They're just magnificent. So congratulations on this incredible accomplishment. I say this and it bears repeating. There are only 7% of hospitals in the United States are magnet designated. So you are one of a very incredibly excellent and elite group. Congratulations to you. I want to talk for a second about staffing. I know that has been an issue. We are doing so many things related to recruitment and retention, and I just can give you a few of the highlights. We work hand in glove with human resources. We look at our available positions every single week. We are trending downward in the number of openings that we have for both RNs and for PCAs. We've been conducting social events in various areas where we know recruitment is kind of hot. We know down towards Lancaster and up towards Lehigh, there are folks looking for nursing positions. So we've had wine and cheese social events there. We've put up billboards. You may have seen them. We hired agency staff. We hired a large number of agency staff to help to stabilize certain shifts on certain units, because some of you have said, well, our unit is appropriately staffed, but I'm still getting pulled to another unit. So we wanted to stabilize that situation. So there's a whole host of things that we are doing to address that staffing issue. This week there are 38 RNs in orientation. So that's just phenomenal. We're very pleased with that, and I think we're turning a corner here, and I thank you for your patience and your hard work. It has been a struggle, I know, because I've gone out on the floors and seen it and worked alongside some of you as you've gone down this road. So hopefully we're coming out the other side. Exciting news, is that we're moving into the new healthplex. And I know that there is some apprehension and perhaps tension out there about where am I going, what's the plan going to be, when will I see the new building. Please know that you will get answers to your questions, and that's the purpose of town hall meetings like this, is to be able to ask your questions. We may not have all of the answers at our fingertips because this is somewhat of an organic and evolving process. For example, the healthplex is still considered a construction site. So some of you have said, when am I going to get the tour? When am I going to see the space that I might be working in, and so forth? Folks who are going to be working in the healthplex will absolutely get a tour of their working environment prior to working there, likely in the end of November or December. There will be an open house for employees and for the public in mid-October. Folks will be welcome to attend that. And whatever other questions you might have, we want to answer them for you and to allay any concerns, because this is just a very exciting and positive, incredible event for our community. That's a contribution that the organization is making that will last for generations of patients that we are providing care to. I do want to mention that the organization has very intentionally and purposefully made investments in our employees. Our average merit increase in the Reading Health System is about 3.2% per year. It is about 2.8% per year nationally, usually at other hospitals. So Reading Health System is about 14% higher than the national average in terms of merit increases. Last year, in 2016, the Reading Health System invested $542 million in pay and benefits. That is the largest portion of the entire budget of the organization, a large number. Our medical benefits, Reading Health System pays about 82% of premiums on an average, and nationally employers generally offer about an average of 77% of premium coverage for health benefits. So I also want to add that in 2016, $9.2 million was spent on merit increases and $3.3 million was spent on salary market adjustments. So we are investing in great people. We're investing in you. I'm particularly proud of the fact that we spent $2 million last year on educational assistance, a large portion of which has gone to nursing and nursing staff. And so I want to close with, again, thanking you and also saying that we have worked very hard to take your input, and we would really appreciate it. We've had great returns on the surveys, our employee satisfaction and engagement surveys. Nursing is one of the highest participating departments. I'm very proud of that. Let's keep that going. But we want to hear from you. We have a new Press Ganey survey, and it's important to us what you think. As you know, we have been using our learning boards and other forums like town halls, advisory groups to help us to make changes based on what you would like to see and what your concerns are, and we would like to continue that trend. So thank you. I hope you have a great town hall meeting, and I can't wait to see you at the new Healthplex if I don't see you before.